Cardiovascular disease is the leading cause of death in Europe as well as worldwide. It's also associated with the majority of healthcare costs globally. One specific high-risk subgroup within the cardiovascular disease cluster are people with hypertension. Today, we'll discover how insurers can successfully implement such digital therapeutic solutions to protect the health of their policyholders. Cardiovascular disease is an overarching term for medical conditions affecting the circulatory system, like the heart and blood vessels. It's commonly associated with an abnormal buildup of fatty deposits on the inside walls of a person's arteries. Some of the most common diseases that affect the circulatory system include heart attacks and strokes. Each year, cardiovascular disease causes 3.9 million deaths in Europe and over 1.8 million deaths in the European Union. Specifically in Germany, cardiovascular diseases are the leading cause of death, accounting for a total of approximately 40% of all deaths. So, what exactly causes cardiovascular diseases? There are a lot of different things that can increase one's risk of getting cardiovascular diseases. These are called risk factors. The more risk factors you have, the greater your chances of developing cardiovascular diseases. Let's hear from Stefan Herrmann, developer of health programs from Generali Health Solutions, on the varied causes of cardiovascular diseases.
There are several causes of cardiovascular disease. Hypertension, also known as high blood pressure, is one of the most important risk factors. Apart from that, we are also looking at other factors such as smoking, high cholesterol, diabetes, inactivity, obesity, diet, as well as alcohol consumption, age, and also genetics. Amongst all the distinct factors, we decided to narrow down our scope and really focus on helping our patients with hypertension. Hypertension itself is already a highly prevalent disease, with almost 30% of all adults in Germany suffering from it. Under normal circumstances, hypertension can be well controlled through medication, a healthy diet, and endurance training. However, a hypertensive individual is lacking medication adherence and is not following a specific diet, the risk for cardiovascular disease increases exponentially.
Treatments for hypertension can be time-intensive and extremely costly. Generali Health Solutions was already successfully deploying several phone-based personalized coaching programs for individuals with chronic diseases, with the likes of diabetes or chronic back pain. Being at the forefront of health programs, the team at Generali Health Solutions made it their clear goal to expand their offerings into hypertension and help their policyholders in this area. Helena Jan, Cooperations Manager at Generali Health Solutions, shares with us what the team had in mind for the hypertension market.
Generali Health Solutions is part of the international Generali Group, a key player in the global insurance industry. We are a provider of effective health programs that can be used by policyholders in companies and other institutions. We have already implemented phone-based personalized coaching programs for diabetes, chronic back pain, and heart failure. Although these phone-based programs are highly effective, they are labor-intensive, costly, and more suitable for a smaller target group that consists of the very sick. For this hypertension use case, our objective is to offer an app-based behavioral change solution that is scalable. The idea is to provide these patients with a simple and easy way to access health coaching that does not require personal coaching over the phone.
To learn about how this might work in practice, they have partnered with Pathmate Technologies, a startup from Switzerland. Pathmate Technologies was founded in 2017 as a spin-off from the Center for Digital Health Interventions, a joint initiative of ETH Zurich and the University of St. Gallen. Their technology and approach of digital coaches is based on years of research, and the success of digital coaching has proven in numerous scientific studies.
With the help of the team at Pathmate, we were able to tailor their program offerings within their product Manoa App to the needs of our policyholders. This project aims at reducing the blood pressure of the patients influencing lifestyle adoption of healthy nutrition and increasing mobility. Engagement of the patients is also important to ensure consistency in the effectiveness of the program. Therefore, patient feedback was extremely important during the testing phase.
Some of the biggest challenges insurers face in launching such digital health programs is digital engagement and adoption. There is an abundance of digital health applications or digital therapeutic solutions, but not all of them are able to use the right methodologies to achieve high rates of customer adoption and frequent engagements with the app. As co-founder and CCO of Pathmate Technologies, Michelle Hepler explains, engagement with digital programs has inherently been a challenge.
User adoption and engagement is a challenge in realizing the full potential of digital health. We at Pathmate tackle this challenge by combining behavioral science concept, the power of data, and smart devices. Manoa is not just another management app, but a digital coach proactively guiding and supporting people in managing their hypertension in everyday life. Each coaching journey is unique and tailored to the patient's health condition, behavior, and preferences. Thereby, Manoa creates personal relevance for each user, motivating them to achieve their individual health goals. We are very proud that Generali Health Solutions and their policyholders can now benefit from the highly personalized and scalable coaching of Manoa.
By offering the Manoa app to their policyholders with hypertension, all these patients need to do is to register via the Generali Health portal and download the Manoa app to get access to the coaching programs. With one single app, patients are supported with the correct measurement of their blood pressure and are given personal recommendations for their measured values. Patients can easily record their readings using a smartphone camera or connected blood pressure monitors and share their blood pressure reports with doctors during a visit to the practice. The Manoa app also motivates patients to lead a healthy lifestyle with individual goals for nutrition, exercise, and relaxation by producing tips in the form of videos, articles, and audios so that patients can learn more about their hypertension journey.
4 months into the program, we were able to draw some initial findings around the target group using the Manoa app. Despite being a digital solution, interestingly enough, the average age of the program user is 63 years. This is exceptionally encouraging to us, as our team had doubts about the acceptance of an app-based health program amongst the elderly group with chronic diseases. Apart from the segment over 60, the app is also extremely popular amongst the age groups 45 to 60.
In terms of gender analysis, men sign up twice as often as women. This is encouraging, as studies have shown that men are more prone to suffering from cardiovascular diseases than women.
Additionally, it is very encouraging to see that the Net Promoter Score for the first 4 months of the program was over 64, showing that the users really enjoy using Manoa, also the older ones.
This is the opportunity for insurers to expand their offering and thus value add to their customers. Pathmate enables exactly this and can therefore not only help patients to better their health status and make treatment easily accessible, but also reduce the burden on the healthcare system for taxing treatments and aid in reducing insurance claims in the long run. Coupled with the effects of the COVID-19 pandemic, the use of health apps and digital therapeutic solutions have skyrocketed. This trend is expected to continue through the next few years and will most likely be boosted with the increasing consumer need for convenience and digital services.
In summary, we believe in a future where digital health coaches can be leveraged to enable personalized and scalable support for people with chronic conditions, helping us to empower them to live healthier and happier lives.